Hi everyone, welcome back to the channel. As practicing physicians, we know that we have to keep up with the latest guidelines and the latest literature. Our patients depend on us, but it's hard to keep up when there's only 24 hours in a day and so much of our time is dedicated to our patient care, our work, and of course our own family lives. So today I want to share a few practical strategies to help you stay evidence-based without burning out. First one is to read a single topic, not a whole guideline, not a whole entire journal issue, just one manageable subject that moves your knowledge forward on a daily basis. Schedule the time ahead of time, whether it's in the morning for 5 minutes, in the afternoon, or in the evening right before you go home from work. Choose a topic and choose a time to be able to make sure you address that one topic that you want to cover that day. Number two, keep a running reading list. Throughout the week, whenever something comes up, something on an EKG, something about a medication, something about a tricky endocrine case, a dermatological issue, whatever that is, add it to your list. And then over the course of the week, schedule the time on the weekend to make sure you close those gaps intentionally. Number three, build a monthly structured reading plan. Instead of doing whatever comes into your inbox from Medscape or somewhere else, actually plan out what your deficiencies are. If you know that you need to improve your skills on OBGYN topics or pediatric topics, make a list of 4 topics, one topic per week that you're going to cover and you're going to make sure you cover before the end of the month. And then, of course, you want to make sure you use trusted evidence-based resources. Having a reliable point of care reference is valuable. It's almost invaluable in clinic because you only have a few minutes to find that information and you want to make sure you're using trusted resources. Let me share some of my trusted resources with you. The American Family Physician Journal, AFP, the Cochrane Database, Guidelines.gov and Guidelines Central, Lancet, Mayo Clinic Proceedings, and New England Journal of Medicine all have excellent review articles that come out every month and they change the topics every month. The guidelines from the specialty societies like American Academy of Neurology, ACOG, APA, these are excellent resources as well. American Heart Association and American College of Cardiology. Any specialty guidelines are also available readily and they're available free in most cases. And then, of course, eMedicine and UpToDate are also solid options. And then last but not least, you want to pick 1 or 2 journals that you're going to read every month. Personally, for me as a family physician, I make sure I cover the American Family Physician Journal every month, cover to cover. This helps me keep grounded and make sure that I stay current with the relevant topics in my field. And then, of course, attend a high-quality CME conference. If you really want structured, efficient learning, attending a high-quality CME conference is the way to go. At CME Travel Academy, we do the legwork for you. Every one of our sessions is based on the top chronic conditions in America. We base on outpatient practice, and then every slide is evidence-based and referenced to make sure that you're looking at the latest guidelines or the latest clinical trial. All of our sessions are guideline-driven, based on the latest trial, and focus on top chronic diseases. We also want to make sure that these are geared towards you in primary care as well as for specialists. Our goal is simple. We want to help you save time by making sure you still deliver evidence-based, quality, patient-centric care. If you found these strategies to be useful, make sure you like and subscribe to our channel and check out our upcoming CME conferences at cmetravelacademy.com. We have a conference in March in Vegas. We have a conference in New Orleans in March, San Diego in May, and July in Disney World. We have more coming up soon, so check our website. And then, of course, for those who love to travel and learn, we have the most flexible options such as CME Anywhere, where you can choose your location, and then custom CME, where you can choose your dates, choose your location, choose your times. Again, think of us at CME Travel Academy and make sure you learn on a daily basis. Thank you again. This is Dr. Pillay with CME Travel Academy.